All right, well, thank you for joining me today. We're going to be talking about cardiac pathology, and we're going to start out with heart failure. Now, in our last video, we were talking about the blood vessels, but today we're going to focus on the heart and again talk first about heart failure and then go into ischemic heart disease, hypertensive heart disease, and then end this with congenital heart disease. So heart failure, the definition is, it is the pathophysiological process in which the heart, as a pump, is unable to meet the metabolic requirements of the tissue for oxygen and substrates despite venous return to the heart being normal or increased. And basically what that means is the heart itself is not able to do what it's supposed to do. Everything else being equal, the heart is failing. Now, in order for us to talk about the heart, let's just kind of go over a little bit of physiology, and you might want to refer to the cardiac blood pressure video under physiology on my website, or excuse me, my YouTube site, in order to refresh your memory about all of this. So cardiac output is the heart rate times the stroke volume, and it changes with heart rate, it changes with stroke volume, and we have control of heart rate by the autonomic nervous system. You know, sympathetic nervous system releases epinephrine and norepinephrine, and we have an increase in heart rate. And then parasympathetic nervous system is going to decrease heart rate. And then we have control of stroke volume, which we're going to talk about preload, contractility, and then also afterload, so that you have a little bit more idea of what this is all about. So cardiac output is the milliliters of blood ejected from the ventricle per minute. And a normal adult cardiac output is about 4.7 liters, or about 5 quarts of blood per minute. Stroke volume, on the other hand, is the milliliters ejected from the ventricle per beat. And when you look at stroke volume, it is made up of end diastolic volume and end systolic volume. So if we raise end diastolic volume and lower end systolic volume, we're going to be able to increase stroke volume. And this has to do with preload and afterload. Now, one other thing that you need to re-familiarize yourself with is the Frank-Starling law. And basically with the Frank-Starling law, what that's all about is if the ventricular muscle is stretched, the actin and myosin, the contractile units of the heart, are able to line up better. And when they align better, they're able to give us a greater force of contraction. So when you have ventricular hypertrophy, this is an increase in the mass of these contractile elements. So you have more actin and myosin in the muscle than you had before. And the more actin and myosin you have, the more actin and myosin that combine, the greater the force of contraction, or you have an increase in what we call contractility. The sympathetic nervous system, again, if we increase that, two things are actually going to happen. One is that you're going to have an increase in heart rate, like we talked about. Epinephrine, norepinephrine is going to bind to beta receptors, what we call an adrenergic response. But you're also going to have an increase in contractility. And the reason that that happens is because epi and norepi can also bind to receptors on the myocardial cells themselves and cause calcium to flood into this cell. And the more calcium in the cell, the more actin and myosin that bind. The more actin and myosin that bind, the greater the force of contraction. Then you can also have an increase in the RAA system. R stands for renin, and then A is angiotensin, and then also aldosterone. And what this is doing is it's going to help to increase blood pressure, it's going to help to increase circulation, and then eventually increase venous return. So preload, these are factors affecting the heart as a pump. And preload can be defined as the initial stretching of those cardiac muscle cells or those myocytes prior to contraction. And the way that muscle is going to stretch in the heart, ventricular muscle, is that we're going to have an increase in venous return. So that means more blood is going to fill up that ventricular chamber, and that also equates to an increase in end diastolic volume. So preload is related also to the length of the sarcomere. So when ventricular muscle has stretch to it, that actually increases the length of the sarcomere. And then preload is also related to, like we said, the end diastolic volume. Now, when it says it depends on compliance too, compliance is the stretchiness. So for this whole preload to occur, the stretching of those cardiac muscles, you have to have individual stretchy muscle cells, and that's not going to happen if those muscle cells are not healthy. Afterload is the force that's needed to eject blood into the circulation out of the ventricles. So that force of contraction, or the contractility, is going to occur when more actin and myosin can bind. So there's two things that are going to do this. One is you have an increase in sympathetic nervous stimulation. More epinephrine, norepinephrine allows more actin and myosin to bind, greater force of contraction. Another is the Frank-Starling law, or that increase in preload, so that the muscle cells stretch. This increase in force is going to push more blood into the arterial system, so blood pressure goes up, and that would include pulmonary artery pressure. Another thing that is going to increase afterload is valvular disease. So if you can think of aortic stenosis, for example, where there isn't the ability for blood to be ejected as well out of the aorta, what happens is some of that blood regurgitates and it goes back into the left ventricle. And so now you have to increase the force of contraction in order to have a good, what we would call ejection fraction, or a good amount of blood being ejected from that ventricle. Let's talk about heart failure again. This is the endpoint of many types of heart disease, such as hypertension, cardiomyopathy, vasculitis, and we'll talk about each one of those. It's very common in the United States. 5 million people are affected each year. About 300,000 people die from heart failure. And basically, the heart can't pump blood fast enough to meet the demands or the needs of the body. So the heart can't fill with enough blood. The heart doesn't have enough force to be able to eject that blood. So the results are the person is very tired. They have to reduce their physical activity. They have shortness of breath, and that's because, number one, they don't get enough oxygen circulating around into the system, but also, number two, you're going to have an increase in carbon dioxide levels in the blood. And if you remember, when CO2 levels go down, or excuse me, when CO2 levels go up, the pH of the blood goes down. And when that happens, you can have denaturing of proteins, various enzymes, and you can have other problems in the body because of that. So the system's going to respond to this heart failure. So the heart isn't pumping like it should, and the body goes, okay, this is not a good idea. I'm not getting enough oxygen. My pH is dropping. This could kill me. I got to do something. And so one of the things that's going to happen is we're going to release more epinephrine, more norepinephrine, in the hopes that this will make the heart contract harder, the muscle will work better, and we'll be able to pump that blood around. At the same time, you're going to increase the Frank-Starling mechanism that's occurring too, and that's going to do the same thing for us, increase cardiac contraction. Now, because the heart is working harder, and it's just like any other muscle, skeletal muscle, whatever it may be, anytime you work it harder, it's going to hypertrophy. The muscle is going to grow in size. Now, by hypertrophy, what's happening is initially you are developing more actin and myosin. And like I said already, the more actin and myosin you have, the greater the force of contraction. But we're going to see eventually the hypertrophy continues, and this turns out to be a bad thing for the heart. So eventually it doesn't work because the myocytes start to degenerate, and because of this, the heart needs more oxygen, and the heart becomes very ischemic. It doesn't have good blood flow, not enough oxygen, and you're going to have even greater heart failure. So there's three types of heart failure we're going to talk about. There's right-sided heart failure, left-sided heart failure, and congestive heart failure. So right-sided heart failure occurs if the heart can't pump enough blood to the lungs to pick up oxygen. Okay. Left-sided failure occurs if the heart can't pump enough blood to the rest of the body, or that systemic circulation. And congestive heart failure is the third type, and we'll talk about that. So right side heart failure may cause fluid to build up in the feet, the ankles, legs, liver, abdomen, and the veins in the neck. So think about, you have the blood coming from the body through the superior and inferior vena cava into the right atrium of the heart. The blood goes down into the right ventricle through that tricuspid valve, and then it's supposed to be ejected out of that ventricle through the pulmonary trunk, through the pulmonary arteries, and into the lungs. But it can't happen. It's not happening. So if the blood's not going into the lungs, it's backing up into the ventricle. From the ventricle, it's backing up into the atria. From the atria, it's backing up into the body. And anytime there's an increase in blood pressure in your vessels, that increase in blood pressure in the vessels causes fluid to leak out of your vessels. And when that fluid leaks out of the vessels, it's leaking into the surrounding tissue, and you have edema. You have fluid buildup. So if it's leaking into the spleen, if it's leaking into the liver, you have splenomegaly, hepatomegaly. If it's leaking into the abdominal area, you have ascites. So right side and left side heart failure may also cause shortness of breath and fatigue. Because remember, if I can't get it to the lungs, I'm not getting oxygen to the rest of the body. Same thing happens with the left side. I can't pump, even if it's oxygenated blood, I can't pump it out to the body. So right-sided heart failure is the leading cause of heart failure due to diseases that damage the heart. So diabetes, high blood pressure, coronary artery disease, they can all lead to right side heart failure. Right ventricle fails, the blood backs up in the body like we said, and so some of the common causes again, left-sided heart failure can actually lead to right side heart failure. So if you think about this, the left side is failing. So let's back the blood flow up. Left ventricle can't squeeze hard enough to eject the blood out into the systemic circulation. So instead, the blood backs up into the left atrium. And then from there into the lungs. From the lungs, it backs up into the right ventricle. And now what's happening is because the blood in the heart, in the lungs and in the left side of the heart is accumulating, the right side of the heart has to work super hard to pump that blood and get it moving through the lungs and through the left side of the heart in order to get it out into the circulation. That puts a lot of pressure on that right ventricle, and eventually that right side of the heart begins to fail. Now, another thing that can happen is lung disease, or what's called cor pulmonale, can occur. And this leads to the right side heart failure because this person has long-term high blood pressure in the pulmonary arteries and in the right ventricle of the heart. And this is caused by long-term hypoxia. So like chronic bronchitis or even obesity can cause the cor pulmonae. Some congenital heart diseases, which we'll talk about later, can cause these, and heart changes such as right ventricular hypertrophy or dilation can cause it, as well as right atrial enlargement. So again, we talked about the fact that right heart failure can lead to edema throughout the body, and this is what we call peripheral edema, and that can lead to pitted edema in the lower limbs. And so what happens with pitted edema is you have the swelling, let's say like in the legs, and you can take your finger and push into somebody's calf, and when you push into their calf, there's a little pit that occurs. And typically we know that the pitted edema is bad if that pit stays there for more than, let's say, like 45 seconds, if it doesn't go away. Because everybody gets a little bit of a pit, but usually it goes away within 10 seconds, let's say. Pitted edema can stay for much longer. You also have a congested liver, which is hepatomegaly, and something that's referred to also as nutmeg liver, splenomegaly, which we talked about. And most chronic cases of heart failure are bilateral. Usually you see left heart failure leading to right heart failure. So this is just an x-ray. It shows on the left a normal heart, and then on the right you can see an enlarged heart. So this is just normal, this is enlarged here. All right, so we're going to talk about congestive hepatopathy, and this is also known as the nutmeg liver. So the liver dysfunction is due to venous congestion due to either right heart failure or congestive heart failure. So think about this. So blood is coming from the liver up the inferior vena cava to the right side of the heart. So if the right heart is failing, then that blood is going back down the inferior vena cava and going back into the liver, and that's what's causing the venous congestion. So you have increased pressure in what's called the sublobular branches of the hepatic veins, and that's causing engorgement of venous blood. And again, this is the right heart failure that most often is doing this. So what happens is these central regions of these hepatic lobules kind of look reddish brown, and they stand out against the non-congested regions of the heart. So here's the hepatic vein, and it's going back into these central lobular veins, and it's creating in this area this kind of dark red, light red type of looking thing, and that's what you see here. And if you've never seen a nutmeg before, it looks very similar to this. And so this is what we call nutmeg liver. Some of the symptoms would be shortness of breath, swelling of feet, and again, this is from right heart failure. These are the symptoms: chronic lack of energy, difficulty sleeping at night, and that's due to the fact that when you're laying down, the blood is backing up even more, and it's not able to pump around through the lungs and so on. Then you have swollen, tender abdomen, loss of appetite. You may have a cough with frothy sputum, increased urination at night, confusion, impaired memory. All right, so let's talk about left side heart failure now. This is when the left ventricle fails. So blood can't be pumped to the body, and blood backs up into the lungs. And so again, the person has shortness of breath, pulmonary edema. The most common causes of left heart failure first would be ischemic heart disease, and this ischemic meaning lack of oxygen, and this causes damage to the myocardium, and this lack of oxygen is typically due to atherosclerosis, and because it doesn't have enough oxygen, the muscles aren't able to contract nearly as forcefully as they should. Another problem would be systemic hypertension. So because there's arterial pressure buildup, it's much more difficult for the ventricle to pump that blood into the systemic circulation. And so again, what's going to happen is as that ventricle has to work harder at pumping the blood, you're going to see hypertrophy of the muscles so that it can contract with even more force. And because it's contracting with such great force, it's going to have a tremendous need for oxygen. But here's the issue. Because there's such great force, it's also contracting down on the coronary arteries. And when it contracts down on those coronary arteries and it contracts down and holds tight, then it is blocking off that extra needed oxygen getting to the muscles. And so now what happens is you go into ischemic heart disease and you can't get that oxygen to the muscles. So the muscles become weaker, and that eventually leads to systolic failure. So causes of left heart failure also would be dilated cardiomyopathy, and this is when the ventricles enlarge in an attempt to fill it with greater volume of blood, or what they're doing is they're trying to increase preload, and by doing that they're stretching out the muscles. And again, the whole idea is the ventricles are just not contracting like they're supposed to. The heart is failing, so we want to do everything we can to get the ventricles to contract harder. But over time, what will happen is those cardiomyocytes are going to die, the muscles get thinner, they get weaker. And sometimes what happens is they can become so thin, they're like tissue paper thin. So you can look here on the left side and you can see normal left ventricular muscle, much thicker than the right ventricular muscle. But as we do this cardiomyopathy, the muscle is going to eventually increase in size, but then it starts to stretch out over time and the muscle thins. And you can see the ventricle gets much, much larger than it's supposed to be. And it becomes very weak and overworked. So another problem with left heart failure is dyspnea, which is shortness of breath because the fluid's building up in the lungs around the alveoli. The person may have orthopnea, which is they're going to have shortness of breath while lying down, proximal nocturnal dyspnea too, and enlarged heart, increased heart rate. You may also hear fine rales at the base of the lungs because of the fluid that's built up there. And then you might see mitral valve regurgitation because initially, I should say, you have this excess pressure that's building up in the left ventricle of the heart, and that pressure will actually create pressure on the mitral valve, and eventually that mitral valve may begin to fail, and so you have a systolic murmur. All right, so last of the heart failures is congestive heart failure, and this involves both the right and the left side of the heart. So it leads to congestion in the lungs, the liver, the abdomen, peripheral edema. Decreased cardiac output is the big deal, and then that leads to decreased venous return as well. There's a decrease in stroke volume, decrease in cardiac output. Congestive heart failure, we have all kinds of cardiac compensatory mechanisms that are going to try to get the heart to pump. So one of the things is tachycardia. We've already kind of talked about that. We're going to get the heart to pump faster because remember, cardiac output is heart rate times stroke volume. So if I can't increase stroke volume, I might be able to increase heart rate, and in doing so, I can increase cardiac output. I'm going to use the Frank-Starling law and dilate those ventricles, and I'm going to increase force of contraction, which would lead to myocardial hypertrophy. However, when it contracts too hard, I'm going to have that hypoxia, that ischemia, which eventually that's going to lead to the cardiac deterioration, the muscles actually falling apart. So these are just some consequences of both the left and the right heart failing. Again, splenomegaly, hepatomegaly, you have ascites, peripheral edema, pulmonary edema, and then you can see the cyanosis. So that might be around the lips, the fingertips, and in males, the ascites can also be in the scrotal sac. So these are some of the different things we talked about with left-sided heart failure. You have the ventricles not able to pump blood, and it can cause right-sided heart failure because of that backup into the right side of the heart. The right ventricles eventually are going to fail as well, and then you have congestive heart failure. And you can go over chronic lung disease, coronary artery disease, pulmonic stenosis. These can all lead to these problems. And then in the next video, we're going to talk about ischemic heart disease.